Alright, so we're doing oral medication, which would just include regular oral, or sublingual, or buccal. So I'm in the medication room. I'm going to perform hand hygiene. I'm going to look at the patient's MAR, collect the correct drugs that the MAR calls for at this time. I would discuss the 5 rights: right patient, right med, right dose, right route, and right time. And then I would also discuss the nursing considerations for administering this drug. If it calls for a unit dose medication, I would select the proper dose, let's say 1, put it in the cup, and take the cup to the patient's room. If it is a multi-dose container, I would put the correct dose in the cup, say it calls for 4, and then take that to the patient's room. If less than 1 tablet was required, I would use a pill cutter. If, depending on the client's ability to swallow, I might see if the tablet or pill can be crushed. If it is a effervescent tablet, I would take the pill to the client's room and I would dissolve it in water at the bedside. If it's a liquid medication, I would just pour the correct amount into a measuring cup or whatever certified measuring device and take that to the client's room. Alright, so then leaving the bedroom, going to the patient's room, I would knock, ask if I can enter. I would wash my hands and provide privacy, and then I would identify the client by looking at their wristband, asking them to state their first and last name and date of birth, and also scanning the wristband. If the medication needs to be scanned, I would scan the medication as well. And if not already doing so, I would assist the client to a high Fowler's position for easy swallowing. And while I am putting the tablet or breaking the tablet open, in this case, I would discuss the reason for administering this medication. I would offer some liquid to pre-moisten the oral mucosa before giving the tablet. If they are able to do so, I would just hand them this and the water, have them swallow it. If not, I would take the cup, put it to the lips, give them water. If it is sublingual, I would instruct them to do so, would put the tablet under their tongue and have it dissolved there, telling them not to swallow, that it's meant to be dissolved under the tongue. If it is a buccal medication, either I would tell them to do so, put it in their cheek, between their cheek and their teeth, and have it dissolve there, again instructing them to let it fully dissolve in the cheek. And then any route, you're going to stay with them until the medication has been swallowed or dissolved, and then offer them liquid again, and then dispose of anything you need to. Help them to a comfortable position, hand hygiene, and then document on the MAR the medication given and the time and the route.